Yes, okay, it is done.
Okay. Okay. Now I am going to. Namaskar, everybody. Good morning. It is our total pleasure to have this special discourse session with Dr. Murthy. Dr. Murthy is a physician, integrative primary care physician by profession. He studied in Mysore and then studied further in England. And then he came to this country in the 80s, where since when he has been practicing in the Florida region since I believe 1984. He has been associated with our premier institutions, both University of Miami and Baptist Care Center in Miami. And now he has his own practice, and he is the owner and really the founder, the visionary for Scope Foundation, which is uniting humanity throughout the earth. He also specializes, he writes, he speaks, and he speaks about not only integrative medicine, but he speaks about power of prayer. He speaks about our Mother Earth, our planet Earth. He speaks about physical activity and how spending an hour a day on ourselves would add enormous benefit to our physical and mental well-being. Last time, Dr. Murthy spoke to us on the physical side of our activities. Today, his concentration is going to be on the emotional and mental well-being. So without further ado, inviting Dr. Murthy to share his wisdom with us. Namaskar, Dr. Murthy.
Yeah,
welcome.
Namaskar. So thank you for the wonderful introduction, Shafali. You summarized the whole presentation in a very brief way. Excellent.
Thank you.
Excellent. I would like to thank International Hindu Organization and also all the organizers, and especially Shifali, you are putting a lot of time and effort in organizing a lot of activities for IHU. With that in mind, today's topic is going to be active relaxation of the mind. What it means is, before we discuss that, I would like to show our prayer to our Mother Earth. If it is okay with all of you, you can join me. There will be 3 chantings, one on the Mother Earth, another one on Sun, and then the combination. So you can repeat, join with me, or you can repeat after me. We'll start now. Om Shri Bhudevi Namaha.
Om Shri Gurudevi Namaha.
Om Shri Bhumata Namaha.
Om Shri Umamata Namaha.
Om Shri Suryaya Namaha.
Om Shri Suryaya Namaha.
Om.
Om.
Okay. So today's topic is going to be active relaxation of the mind. The reason I put in the Mother Earth as a first slide with the active relaxation of the mind is, a lot of us are aware of the material resources of the Mother Earth. We talk about the gold, we talk about platinum, we talk about this, we talk about oil, all of that, and the environment. All of that is related to the physical existence and how we can survive with the resources of the Mother Earth, okay, with the physical existence, for the physical existence. There is another energy of the Mother Earth. It is called spiritual energy. I have done a lot of work with all my patients and different groups of people. When you meditate on Mother Earth, the energy accentuation, what you have, is exactly the same as when you do the meditation on your Ishtadevatas or any other concept what you have. That tells us the Mother Earth also has a spiritual energy which we have not been able to tap and concentrate upon. The main advantage of having focusing on the spiritual energy of the Mother Earth would be, it would bring all of us together because we are all made ourselves that we are the children of the Mother Earth, and her spiritual energy is universal in nature, easily and equally accessible to all of us. That would bring us a sense of belongingness to the Mother Earth and sense of unity as brothers and sisters of our planet. So having said that, we'll discuss more on that. Okay, so I said active relaxation of the mind. We can see the brain, but we cannot see the mind, but we can feel the mind. So always we say, I'm mentally stressed. So that means it is the mind. Mind is defined as, it is a bundle of thoughts. You can feel it, it is very powerful, but whatever the thoughts and the power of the mind is mediated through the brain and implemented through our physical body. For example, if I want to go from here to Deadland Mall or to Orlando, that is a thought generated in the mind. If that thought gets consolidated, that would be informing the brain to implement it. Brain has the appropriate methodologies to implement that. It will implement it through the physical body. So that is the, in short, mind and the brain. So the stress is felt at the level of the mind. When that is felt, just like the dominant thought process have an impact on the brain and on the body, the same thing happens when there is a negative stress, and also same thing happens when there is a positive stress. So when the stress is negative, we call it as stress. When the stress is positive, for example, you have been told, you had a baby or you had a grandchild. That is a lot of pleasure for a lot of people. When you are confronted with that, exposed to that excellent, pleasurable information, our heart and our body reacts in the same way as it reacts with the negative stress also. But unfortunately, negative stress are more common than the positive stress. The second unfortunate thing is the negative stress lingers on within us for a longer period of time. If there is a positive stress, a pleasurable event, at that moment we are happy, after some time it is forgotten. So because of the longevity of the negative stress, the impact on the physical organs are much more longer and harder. That is what happens. So physiologically, when the stress happens, negative stress happens, there are a lot of hormones get released. Those are adrenal hormone, noradrenaline, and cortisol. Adrenal hormone is a very powerful hormone. If the stress is continuously chronic, what happens is it releases another more powerful than adrenaline hormone. It is called noradrenaline. If the stress is continuously happening, it also releases the steroid called cortisol. Cortisol is very, very essential for healing of a lot of inflammation. But if the cortisol is consistently produced at a higher level, that the effectiveness of healing becomes a distraction for it. In fact, it induces the inflammation. In addition to that, it induces high blood sugar and a lot of other catastrophes for the physical body. The stress also has an effect on the cardiovascular system, like the heart rate being increased, blood pressure being increased, heart starts beating at an irregular beating or a very fast beating, and all of that. It also has an effect on the liver. What happens is our liver is the biochemical storage factory of our body. Whenever there is a stress, we release the adrenaline. That adrenaline goes and kicks the liver. When that happens, the liver being the storage organ It releases the blood sugar as well as the cholesterol, thinking, body needs the energy. But the body does not need the energy because the stress is excessive. The release of the cholesterol as well as the blood sugar will be in excess. That causes the diabetes. It is called stress-induced diabetes, which is very common. What are the things we see in the office? These are all a short list of things, just to give an example. Okay, headache is a very common problem because of the stress. Ulcer diseases is also common, not only in the stomach, but more commonly nowadays in the large intestine called ulcerative colitis or irritable bowel. People do lose appetite, but most of the time people eat more because of the gratification. Always they are fatigued, okay, no energy. Okay, every day, they have some kind of a complaint. I have this pain or that pain, I don't feel good, and all of that. No matter how many tests we do not find any obvious reason to treat them. And most of the time, it is emotionally related. And also, people under stress have short fuse. They would not have a lot of tolerance if you do not agree with them, if you want to have any other discussion with them different than their view, there is going to be a short. Sleeping problem is a very common problem. As I said, it also increases the blood pressure. Many a time, I have seen patients with normal blood pressure, when they come to the doctor's office, if it is 120 at their home, it is always 140 to 160 in the doctor's office. That is basically a transient stress. Heart rate gets increased. The commonest reason for infection in this country is the stress, because the stress reduces the immunity of the body. Because of that, I will give you an example later on. Negative stress reduces the immunity. In fact, in Harvard, they did the experiment of collecting saliva and testing the immunoglobulins in the saliva from 100 graduate students in Harvard University. They were showed a video of Mother Teresa doing the service to the humanity for about 10 minutes to 15 minutes video. They have tested the immunoglobulins of all the 100 people. And then after they have tested it, they also had the questionnaire to give them positiveness or the negativeness of that video. No matter what we show to anybody, some people will appreciate it, some people do not care about it. So there are people who did not appreciate what Mother Teresa was doing. Those individuals, immunoglobulins were declined within that 10 minutes of presentation because of their non-appreciative negative thinking what they were having. Whereas the other people who said very appreciatively and really appreciated the Mother Teresa's service, the immunoglobulin went higher. That tells us positive thinking or positive feeling towards the life always helps to prevent the infection by increasing our immunity. There are short-term stress, there are long-term stress. Short-term stress is very essential because it activates our inner power to survive the challenges and also to learn more things and other things. This is very creative, short-term stress. If there is no stress, it is boring. But that same stress becomes long-term. For example, constantly there is no break from the stress. Then what it does is, it activates what we call it as a HPA axis, hypothalamus, pituitary, and adrenal axis. When that happens, constantly all these stress organs are working overtime. That induces the involvement on the gastrointestinal tract, cardiovascular tract, central nervous system, creating anxiety or depressions or irritability, and joints, creating a polymyalgia rheumatica. The muscles and the joints get affected, muscles get affected, and all of that. The mechanism here is, before I go to that, there is another entity of the stress is called ERI. ERI, which usually happens in people who are working for somebody else, like a doctors working for hospitals, or sometimes even the doctors working for themselves, they feel whatever the effort they are putting, they are not getting the equal reward. That also creates the stress. So what happens is emotionally, when the person is working for an employer, they are putting a lot of effort. They have an expectation of the reward. Initially, there may be a satisfaction with the reward, but as the time goes on, that reward what they are getting becomes, the value of that becomes diminished in their perception. It could be financially diminished, but in their perception, most of the time it gets diminished. When that is diminished, there is a perception of inequality in the reward for their effort. So that creates a negative phenomena and creates the stress also. So this is what happens in the brain. Let me see whether I can take you to that picture. Okay. If I show you, that would help. Okay. Sorry, this picture is not very good, but I'll try to see. This is the, can you see my arrow? This is the pituitary gland. This is the hypothalamus. Okay. And adrenal gland is on top of the kidneys. So when this one stress is higher, this will try to attack the adrenal gland to produce the stress hormone. This is what happens. Before I go to the other slide, I want you to see, this is the amygdala. This is the happy center or the pleasure center. Okay. And it has the connectivity to all the different organs, which I will explain to you later. And here, if you see here, this is called hippocampus. That is another center, which is very important for memory and also the learning. Okay, these are the two things. But this will take the hippocampus, take the messages from the amygdala, that is a pleasure center, and then act accordingly. So I just wanted to remember those three things. I'll go back to the other slide now. Okay, here. Right. So what happens is, when we are perceiving only the negative stress in our mind all the time, that goes to this center called amygdala, what you saw, and that is processing the negative feeling, negative emotions all the time. And it is connected to the hippocampus, that is the learning and the memory center, and also prefrontal lobe in front of the brain, that is the learning center also. And also it has a connectivity to the hypothalamus, which is the supreme center for controlling the entire endocrine organs. So what happens is, this amygdala, because of the negative stress, what it is feeding with, it will only feed the negativity to prefrontal lobe, hippocampus, and also hypothalamus. Over a period of months and years, if those organs, which are supposed to be producing positive things, will start getting only the negative messages, their functionality get depressed. That is how people under a lot of stress, depression, have memory problem, no interest in learning, no interest in doing some of the positive things what they could have done here. And because of that, their stamina, the emotional stamina becomes reduced, creates anxiety. To overcome the anxiety, many a time people becomes more aggressive because they are not able to balance the positive and the negative emotions. The only way we can react when they are unable to deal with the situation, either get depressed or get angry, and emotions, what we call it is a emotional hijacking. Emotions do not have a proper channel. So that is what happens. Hippocampus, as I mentioned to you, responsible for learning and also short-term memory. The memory get lost because of the negativity fed by the amygdala center. When there is a negative things are happening in the brain cells, Okay, it thinks, the brain thinks, okay, we have an enemy coming and attacking us. So as a defense mechanism, it produces certain chemicals called interleukins and also cytokines. Many times what happens, there is no enemy, it is only a self-induced enemy, and improper thought and analysis of this center producing the interleukins and also cytokines. These are the two chemicals, defensive chemicals, goes and attacks the tissue where they think there is a enemy there. When they attack the normal tissue thinking it is a wrong enemy, okay, there is a war zone and inflammation happens. Just like, somebody going and attacking a country, whenever there is a war zone, there is always a destruction, right? Same thing happens within our body. When there is a war zone by these chemicals to defend ourselves and create that war zone, that inflammation has to heal, which may heal within some time. Sometimes if it is repeatedly happening, it does not heal at all. Not healing that kind of a damage, what happens? Whatever the part of the body which is controlling in that particular part of the brain will get inflamed. And that is why we have the pain in the joints or in the muscles and the memory loss and all of those things. This is what happens. Okay, what are the things happens also because of the stress? It can also have an effect on the genes. They have done a lot of studies, the effect of stress on the genes, and especially Dr. Jennifer Chan from the University of Pennsylvania, they have done that. And Brianna Milligan from the University of New Mexico, they have done a lot of work on that. I will not go into the much more detail here, but fortunately, the effect created by the stress on the genes can be rectified by treatment using the methylation system nowadays. Okay, what do we do with the stress now? I always tell them, many complex problems have simple solutions. Okay, this is one of them. Instead of waiting for the emotional stress attacking us and bringing us down quite steeply, if we can cleanse it on a daily basis, so you would be able, it is impossible for us not to have a stressful life. But it is equally important for us to develop a methodology to cleanse that, just like you clean your table every day, otherwise there will be a dust on the table. You clean your plates because there is a dirt on the plates and all of those things. But most important part in our body is actually our mind. That is the supreme controller of our body. But we do not actually do the cleansing on a daily basis. Those who does the physical exercise, they do feel good because of the production of the endorphins. But that percentage is only 22.9% of the people in the United States does the physical exercise. And of the 22.9% of the people, less than 5% of the people do the active relaxation of the mind to cleanse the mind. So this is why it is very important to do the physical exercise and also to do the mental exercise for active relaxation. These are all the methodologies, not only these, there are so many, but this is simple enough for us to follow it. One is, before we do the meditation, if you go back to our presentation of the previous one, we did the exercise, we are cooling down. We are at a stage where we are cooling down. When we are cooling down, we start visualizing. We visualize all of joints and all parts of the body, feeling they are all normal, one. And also you are concentrating at that time on the universal energy, what we call it is a cosmic energy, and also our Mother Earth. Because we see the Mother Earth the way every day, we live on her, and also by it is easy to visualize her, and also easy to express our gratitude. By initiating the expression of the gratitude, it induces a sense of relaxation within our body. So taking that preparatory visualization, what we have done, then do the pranayama, that is the breathing exercise. all of you know how to do the pranayama. So do that for 5 minutes. I will explain to you, excuse me. I will explain to you physically and physiologically what happens with pranayama. Then do the meditation. You can also do reading of the good positive books, plus classical music. That would help. And also healthy helpers syndrome. I will explain to you briefly all of that. So when you do the pranayama, that is breathing exercise, I would like you to see this here. Here is the nostril. You take a forced inhalation here. You are closing one nostril. Through one nostril, you are taking a deep breath. When you take a deep breath, the air is entering through the nostril, and here you have two air cavities. One is the maxillary sinus, which is just below your eyes, and the another one is the sphenoid sinus, which is just below the pituitary gland, which is the king of our hormonal glands. Okay, because of the physical jolting what it has, it also jolts the sphenoid, and that in turn, because it is sitting on the sphenoid bone, it jolts the pituitary gland, which controls all our other hormonal glands. And because of that, you are really activating your generating center before you start your routine work. That pituitary jolting also jolts the hypothalamus. So you are actually charging all the batteries before you start the work. That is the reason. If you do that for about 5 minutes before you do the meditation, so you have the visualization, and then you have done the pranayama, that is the breathing exercise. So this is another example of showing. So this is the maxillary sinus, sphenoid sinus, and from the air comes from here, fills it up here, and jolts these two things, and then in turn it jolts the pituitary gland and also the hypothalamus. This is the another picture I showed you about the amygdala and all that. Okay, that is the different picture, just more clearer. This is the pituitary gland. You have the sinus here. You have the sinus here. Also, I would like you to watch this, the pineal gland. I will talk to you about it later on. Okay, so when you do the pranayama, it helps in focusing. Pranayama helps in focusing and mindfulness. It removes the carbon dioxide from the body and increases the oxygen. It also reduces your blood pressure. It helps the lung capacity. So chronic bronchitis people and asthma people will be helped. Even the normal people will be helped because they will be able to maintain their pulmonary function, the lung functions very well. And also it helps in having a executive skills, helps in your memory and also flexibility, because you have a lot of resourcefulness within yourself. Any variation you can adapt and guide them very well, and stimulate a lot of endocrine organs, as I mentioned to you before. So the power of thoughts. We were discussing how we are going to concentrate on the Mother Earth and also the cosmic energy. When we are doing that, there are certain changes happens within our body. If you recall, our body consists of 70% of body is our water. So these water molecules, here, there is a scientist from Japan, his name is Masaru Amato. He did a lot of studies on the water molecules and the power of thoughts on the water molecules. For example, this is the regular water molecule before anything happened. If you remember this picture, when they express the gratitude, say thank you, the same water molecule became a crystal molecule here. And next to that, the same person or different person expressing negativity, like, I don't like you or make me sick and other things. Look at the ugly nature of the molecules here. And here, when you express love and affection, it is a different crystal. After the prayer, the same water molecules is a different crystal. What that tells us is any positive thing what happens in our mind does have an impact on the tissues as well as on the molecules of the body. So it is very important for us to analyze. By negative thinking, we will be probably have hurting, we are probably hurting ourselves more than hurting somebody else. Let me see here, I can. Okay. So this is a experiment. I have been doing it for 25 years. I just want to give you one of these examples here. This is actual report from the patient, one of the patient. So this is the baseline energy. I have a methodology to check the energy of the person. So using their hands, this is the person's energy before we did anything. It is 14.47 pounds before we did that. I have told her to bring, this person actually, she works in one of the news media as a newscaster. Okay, she brought 2 bottles of water, which I requested. Putting the small amount of water in her mouth, the energy increased from 14.47 to 15.84. Okay, then I told her to meditate on Mother Earth. I gave her the mantra or the chanting because she did not know the Sanskrit. So I told her to say salutation to Mother Earth. So after she has done it for 5 minutes, the energy became 18.17 pounds. So there's almost about a 2.5 to 3 pounds increase in the energy after 5 minutes of meditation. So if you go back to my previous slides of the water molecules, this 5 minutes of meditation has changed her molecules in the body, which is 70% of the water. So this is the water, what she brought. I gave her the water from whatever I had from the commercial water. That bottled water actually from Baptist water. Okay. The bottled water tested instead of 15.84, it tested 15.40. So that is the energy with the bottled water. After 5 minutes of meditation, she was holding the water bottle. It went up from 15 pounds to 20 pounds, 20.202 pounds. There are a lot of analysis we can discuss, but in the interest of time, I would like to show you there is a 5 pound, almost a 5 pound increase in her energy with the water bottle within 5 minutes of meditation. I divided this bottled water into 2 portions. I put the half of the bottle about 100 feet away in my consultation office. And I brought that water to test, is there any change in the energy? This is not the first time I have done that. I have done this hundreds of times. So that energy which was away from the room, 100 feet away, but this is the baseline energy of that water is 15.4 pounds. And the water which was away from her was 17.82 pounds, almost 2.5 pounds increase in her energy, even though the water was not in the same room and she was not holding that water. So that tells us undoubtedly the positive thinking and the meditation on Mother Earth certainly has a positive effect, increasing the energy. And because of the spiritual nature of the energy, what Mother Earth and our cosmic religion has. Okay, we'll bring it back here. What are the benefits of the meditation? It reduces the blood pressure. All of them, they more or less, they do the same thing. And sense of relaxation. It also increases the endorphins from the pituitary gland. The other important thing is, whenever human beings are happy, there are 3 different types of waves in the brain. The predominant waves when we are happy is called alpha waves. Herbert Benson, he has done a lot of work on meditation and the effect of the meditation on the brain and the hormones. And he has shown the predominant waves in the brain by doing the electroencephalogram is alpha waves, 10 minutes into the meditation. That really helps us to relax. Increases the energy level, and also they have better tolerance. So this is the picture of the solar system, just to give them an idea how small our Mother Earth is. So it is the fifth largest, but very small, but she is very unique because she is the only planet which can support life. And also she works very hard. She works very hard to keep all of us safe. Every life on earth is kept safe for billions of years because of our hard work. In fact, sun, occupies almost 98% of the solar system space. You can put 1.3 million Mother Earths inside the sun also. That is how huge sun is. But Mother Earth is the only one which can support us. Of course, with the help of other planets and the sun rays. So, basically to mention about the Mother Earth, spiritual energy is there for the Mother Earth. She is the only supporting planet. When you see the Mother Earth, when you visualize, it is a divisionless existence. So we will not think about, okay, I belong to India, I belong to Pakistan, Bangladesh. We belong to the Mother Earth, a repository of infinite resources. Billions of years ago, probably she did not have to support so many lives. Now, not only she has gone through a lot of destruction by all of us, but also she still continue to have an increase in demand. Still, she is supporting all the life on earth. Sense of preciousness, by thinking of the Mother Earth as one symbol of unity and home, we all feel a sense of solidarity. She is the only provider of all the basic needs. Just basically, geographically, she is about 93.5 million miles away from Sun, takes about 365.25 days to travel. She travels in a year 587.5 million miles. And she travels at 67,000 miles an hour. And also she rotates at 1,000 miles an hour. So we all get the sunlight in an appropriate way. So what are the guidelines here? So as soon as you get up, okay, select a definite time. As I said before, 90% of the people are very successful in practicing this. When they start, soon after they have heard this program. If they wait, another nice muhurtam will come after 10 days or 1 month, this never happens. All good things has to be started yesterday, not tomorrow. Okay, select a definite time in the morning before you start your work. Entire activity should be uninterrupted. No point in doing a warm-up and then going checking your text messages and then do the warm-up and then go on and do the aerobics and then do another checking and talking to somebody else and then go back and do the meditation. It doesn't work that way. It has to be one package deal, I think, and you need to have the momentum. Momentum of the mind, momentum of the body, and the concentration is so important. So by not having that, it is very difficult for us to achieve the maximum benefit what you could have gotten it without interruption. Okay, no checking the emails, no phone calls, not even talking to anybody. It is only between you and the universe and focusing on at the intellectual level and the mind level and the body level. Empty the bladder and the bowels, warm up for 10 minutes, aerobics for 20 to 30 minutes and a cooling down. Then you attend to your personal hygiene like washing and bathing and all of those things. Use only the tepid water. Identify a specific place. Just like, when you want to enjoy your dinner, you sit in the dining table, not on a sofa and then eat the food on a plastic plate. So here, you identify the place. By identifying that place, as soon as you start walking into that room, you get that initiation that this is a place for peace. And then do the breathing exercise, the pranayama, meditation for 10 minutes. when you're doing the meditation, basically you concentrate on the Mother Earth, how hard she works, and express your gratitude in a beautiful way. Every day when you express the gratitude, you actually enhances the sense of relaxation. That is very important. And there are no losers in expression of gratitude. The person who is getting the gratitude feels happy. Person who is giving the gratitude feels happy. There are no losers there. And by doing it early in the morning, before you start your work, you initiated the endocrine glands, activated the brain waves, you stabilized your power of thinking, power of thoughts and focus, and you express your gratitude, increasing the endorphins, and all of that is happening. Your energy and the outlook on the world is so profoundly beautiful. And everything you get that day, you'll feel so happy because there is nothing to be negative about. And if somebody had a long day, let us say, I would request them not to come home and then start eating or drinking. By doing it, you will consume more food. So take about 10 minutes relaxation. Just do a little bit of stretching and go to the prayer room, wherever you do the prayers and meditation. Sit there, visualize the Mother Earth and the universe for 5 minutes. Come back and then eat your food. You have regained your lost energy, and also you have excellent amount of control on the amount of food what you eat, because you are already happy. You don't need to look for the more and more food to make you feel happier. So this way, your weight control is also very easy. Okay. So, and also would like to mention to you here, whenever there is a sadness, there is a more kindness. This has been shown even during the COVID crisis, COVID pandemic. In fact, around the world, when they did the study about the global happiness and the charities and other things, during the pandemic of COVID crisis, there was also a pandemic of benevolence. A lot of people very kind to each other all around the world, they were. In fact, they did this study here, World Happiness Center, and also from Berkeley University, Greater Good. Okay, what they found is COVID crisis donations went up from 30% to 37%. Volunteering went up from 19% to 23%. And helping the people they did not know, helping the strangers went up from 48% to 69%. These are all the positive things what we have as human beings, but it gets operated when there is a crisis. But if we can have that operated during the non-crisis time, ourselves can be in peace and the whole world can be in peace. There are a lot of countries, in fact, during the COVID crisis, United States had the happiness scale, global happiness scale, we were in the 19th place. During the COVID, even though there was so much of physical distress, we came up to 16th place. We increased by 3 places. This is what happens. There are a lot of countries. The reason I listed them is they're not as financially rich as United States or any other country, but still, these are the countries consistently they are happier than anybody in the world. Finland, Denmark, these are all small countries. New Zealand, I was so surprised. Even Israel, with so much of catastrophe and war zone and everything, they are much happier. We do not know how they are able to achieve it. And Bhutan is constantly happy all the time. Every year, Bhutan is one of the small countries in the world, very meager resources they have, but they are very happy. Okay, so that ends my presentation. If you have the time, I will give you the information about some of the patient actual histories. If not, I'll be open for questions. Thank you very much for your attention.
Please continue, Dr. Murthy. Give us a couple of case histories and then we'll go to Q&A.
Oh, okay. So I would like to go to the patient number 3 here. So just to give you an idea how the emotions can attack any part of our body. Okay, this patient, she is about 50 or so years old. She is from a different country working here, and she has a business of her own, working for almost about 30 years, running her business. She had about 50 employees. She came with the pain in her right leg, in her right ankle. Actually, what happened is she was visiting her country and she kicked the edge of the bed, the edge of the cot a year ago. She continued to have the pain. She took some anti-inflammatory medications and other things, and it was better, but constantly it was getting more and more and more. So after 1 year, she could not take it anymore. She came to see me. Because of the injury, I was worried whether she has an infection in her bone. That is a very common thing what happens with the chronic pain. After we have done that, so x-rays were normal. I also have to do a CT scan of the bone. That was also normal, no fractures or anything. I gave her the anti-inflammatory medication. The pain, let us say the pain, number 10 is the highest pain she had. It was reduced with the anti-inflammatory medication by only 2%. Instead of 10, it became 10, 8. Then, I gave her a stronger steroid because that is another strong anti-inflammatory. There was no difference adding the steroid to her. Then, when these things happens, because of my integrative medicine exposure, I talked to her, something is happening in her emotions. So she had, of course, a lot of us have a lot of emotional issues all the time. She could not think of anything else, new emotional problems, but she had, like everybody else, had the emotional issues. I told her, because this is not responding to the medications, I may have to give a injection of the steroid into the tissues because I do see thickening of the skin and thickening of the tissues deeper inside. I had treated her husband through natural therapies with a shoulder pain which he had it for 6 years. And he is an international accountant. And I went through all the regular allopathic treatments, including CT scan, physical therapy, everything. When it did not work, after 3 months, I gave this treatment called applied kinesiology. Once a week for 4 weeks, I did it for the right shoulder. He got totally better. This is more than 15 years ago. He has not come back for the pain yet. And also left shoulder, after 1 month of break, I did the treatment. He got better also. So that is the information she had. She told me, why don't I give her the natural treatment? The reason I did not initiate that because of the injury history. Then, there is a methodology to assess the emotional impact of the person by using the craniosacral system, CSRD, what I said. When I do that, okay, I told her to remember 2 things in her life, what is very stressful to her. Number 1 is the most stressful. Number 2 is the second most stressful. She remembered. After that, I told her to think about number 1, and I am testing the rhythm of her brain. Okay, there is a methodology to check that. When I did that, it came to a slow halt. I told her to think about the second stress. When she thought about the second stress, it came to a screeching halt. So from her perception, number 1 is the most stress for her. Number 2 is stressful, but not as much as the number 1. But the body indicating me, number 2 is the more stressful to her than the first one. Then I ask her, usually I don't ask them what is number 1, what is number 2. I just test it because I did not want it to be misled. So then I ask her, your number 2 seems to be much stronger for you than the number 1. Can you narrate what the stresses are? Number 1 is her daughter being divorced, is dating a man now, And this man has a child, 5-year-old child, and she is worried whether if the relationship did not work, she is going to be hurt losing her boyfriend, as well as especially the child whom she is attached to very much. So that was her, as a mother, okay, that was her first and most severe concern. The second one was one of her family member is working for her for 10 years. He never learned doing the business in an American way because they are from Brazil. And she has to pay the salary even though he is not producing much. But he cannot complain. If there is any complaint about him, there is a problem in the house. So these are the two things. So then I told her, because of the findings from the craniosacral rhythm, let me do the treatment, what you call the craniosacral relaxation therapy. So I did the treatment. It takes about an hour to 90 minutes. The first treatment, afterwards, it takes about 1 hour. After the first treatment, I gave them a log sheet to grade the pain, to grade their mental relaxation, quality of sleep, and all of those things. So the pain, next week when she came, so the pain was reduced by 80% with the first treatment. So to cut the story short, I did the weekly treatment for 4 weeks. And after the second treatment, pain number is 0. And then the third and fourth treatment. So this was done more than 3 or 4 years ago. And she has not come back. She has not complained of any pain or anything. So the story here is the emotions have an impact on your brain and also on the mind. The only way they can get attention to that distress at the mind level is through producing a pain to the physical body. Okay, I have seen this so many times. Some people get affected because of the emotions, skin rashes develops, they develop the migraine headaches, or they develop the shoulder pains and other things. All of those things are very commonly seen. But unfortunately, when we do not follow the emotions, we end up pumping medications after medications to the patients. It will give the symptomatic relief, but it does not take away the source of the problem. So source of the problem here is the mind. So she got better. The second one I would like to share is the patient with migraine, number 1 patient. So this patient, came from New Jersey. She had been suffering with a migraine headache for 10 years. 3 days a week, she would lock up in her cell, in the room because of the menstruation and migraine pain. In New Jersey, she was given amitriptyline, which is an antidepressant, 10 milligrams, which is a very high dose. And because of that, she was feeling the relief, but not totally stopping it. She was also given Tylenol number 3, which is a painkiller. She was also given naproxen, which is an anti-inflammatory medication. Once in 3 months, she would go, once in a month, whenever she get the attack, she would go to a chiropractor, get a cranial massage. So even then, she would not be able to go and function normally, but she can tolerate her pain. This is what happened. After she moved, she came to see me. And after about 2 months, I was thinking, she has so much good going in her life. Why she is suffering from migraine? And after going through her life history, there was some emotional element I could identify. Then I told her, I have a program. If you could practice it for a minimum of 3 to 6 months, I'm going to give it to you. If she does not do this on a daily basis, any day she misses doing this program, she has to pay a fine of $5, and she need to keep the account and bring the check for the total amount. She did that. After implementing this DLS, Daily Lifestyle Activity Program, in 1 month, we were able to reduce her pain medication from Tylenol number 3 to just aspirin. Next month, I told her to reduce the amitriptyline to 5 milligram after 1 week to stop it totally. And she did not get the headache at all on the second month. And the third month onwards, so there is no headache. So her 10 years of migraine, just following 1 hour of discipline to herself at the level of the body and the mind, we were able to take care of her migraine completely. After she has done that, she went to a Thanksgiving weekend. They are a very financially successful family with their own plane and the boat and all that. She went to Key West to celebrate the Thanksgiving because she was so busy, she did not do the program and she got the migraine headache. After about a month, she came back here and then, she went to New York to help her friend who had a triplet baby. And there, she was so busy, she did not do that. She got the migraine headache again. So she had the proof by doing things, preventive things and self-care things at the level of the body and the mind, how she can combat the physical symptoms of the emotions. That is what happened. So I've been seeing her for about last 30 years. So still, she's managing without any problem. She does practice the everyday DLSA, and those are the things. So many patients, like ulcerative colitis with a patient, who suddenly got divorced by her husband soon after her child was born. We were able to take care of her giving this methodology, and chronic fatigues, so all of that. So I will stop here and then, entertain any questions you have. And then one request I would have is, I'm sure, all of you are doing a lot of things, just like Mr. Gupta ji said. And if you are not doing it, just help yourself, devoting 1 hour for you at the level of the body and the mind. It not only helps you, it helps your family, it helps the society. This is what I would like to. Thank you.
Amazing, amazing session, very, very relevant to all of us, Dr. Murthy, and especially you making the point through the case history helps, because it really seals it in that people who have migraine headache, chronic fatigue, pain in any part of their hip, leg, whatever, there's something else going on in their body. And if they address it with exercise and mental relaxation, they can really self-medicate instead of, and you as a physician telling us that is extremely convincing for us.
Yeah, thank
you so much. I'm going to open the floor for questions. If anybody has any questions or comments, and then I am going to ask Dr. Murthy later on at some point to tell us the relaxation exercises, the 10-minute thing. If you can give us a summary of what that is, the relaxation, the 7-minute exercise that you were talking about at some point, would be very helpful.
Okay.
Thank you.
Yeah, Dr. Murthy, thank you so much. This was so illuminating. So one question I have,
Yeah.
this is wonderful. So are there more physicians who prescribe this protocol? I will call it a protocol because you have been so successful with it to their patients? Because I've been through several different primaries, and I don't recall anybody mentioning other than just the medication. And so is there a big disconnect, or how do we make this thing more popular? Because this is wonderful, this is amazing, right? This is so effective too.
Unfortunately, the way we get trained, okay, the symptoms and medications, dealing with the symptoms. In fact, there are two aspects to it. To answer your question, the short answer is not many physicians are aware of it and they do not implement it. Some, they are knowledgeable about it, they have heard about it, but would not put in the time to learn it, because if you see a patient every 5 minutes or every 10 minutes, okay, you get X number of dollars financially. And if you do this treatment, I'm spending about an hour or 90 minutes with a patient, okay, there is not much of a remuneration that will come through. Unfortunately, money speaks louder than anything else. That is what happens. That is why it is not very popular. But financially may not be popular, but emotionally it is a very satisfying thing, not only to the patient, even to the physicians. The biggest healer or biggest satisfier is the results of your work, not the bank balance.
Right.
So when you have these patients, especially this lady who is such an entrepreneur and a business lady, suffering with ankle pain because of her worries about her daughter, okay, being relieved without keeping her on a tranquilizer is such a satisfying thing for me. I did not send her to a psychologist or a psychiatrist. If I did, she would have become an addict on some medications by this time. Okay. So the other aspect is, it has to be propagated more. Now they are analyzing emotional impact on the physical symptoms by the NIH, National Institute of Health, but still it is a long way to go. I did want to start a teaching to publicize this, So I created a corporation called American Academy of Integrative Medicine, AAA, American Academy of Integrative Medicine. I've given a talk about role of integrative medicine in primary care. I gave a talk in conventions in India to encourage some of them. But the foundation I have, SCOPE Foundation I do have a protocol to start teaching and propagating the integrative medicine concept to the allopathic physicians. This is what I have.
Yeah, so I think we should really discuss how do we help, how do we make this more popular, because this can be such a life-changing process.
Absolutely, Shribhai, we should talk about that, and even what we're doing with Arun Sharma in terms of the natural medicine and what Dr. Murthy is talking about. It's also related, so we absolutely should talk about how we can bring this more to the forefront. And each of us also has lots of, in my own family, I have plenty of doctors and know other doctors as well. We've got to start really at our own personal level before we can really radiate out to the community. So if we start implementing it within our own lives, within our family, and then start propagating it, I think we would have a following for this.
Yeah, but in fact, I did write to one of the what do you call it, professor in FIU. FIU has a medical school,
Right.
and also I sent this patient history with the ankle pain.
Mm-hmm.
So for them as a quiz to ask the patient, ask the students and the doctors in the university how they are going to approach, what investigations they will do, what treatment they will do, what history they will take. I gave them the guidelines. Okay, so there is not much interest. So I have to go on and really see how it can be propagated. Because when we give the questions, I also sent the same questionnaire to India. So 6 doctors responded, but only thing is, along the lines of the teaching. Teaching is give the physical therapy, investigations wise the blood test, okay, then the X-rays, then the CT scan and the MRI. The treatment wise, anti-inflammatory medication, painkiller, steroids, and physical therapy. So these are the things, all at the physical level only. But we have done that, but nothing helped. But one treatment of craniosacral relaxation therapy with the desensitization took away our pain 90%. That is very astounding. That is very astounding. So there is a long way, as you said, but hopefully some younger generation will take up the task for the benefit of the humanity, for the benefit. Otherwise, we are drugging the people too much.
Namaste, Dr. Murthy, the Shekhar Reddy. By any chance, do you know Dr. Ashwin Mehta from Memorial Hospital?
Ashwin Mehta, yeah.
Yeah, he does the integrative medicine. We awarded him at one time at Hindu American Foundation event. So,
great.
yeah, he incorporate integrative medicine.
Okay, nice to know that. Nice to know that.
Dr. Ashwin Mehta at Memorial Hospital, Hollywood.
Yeah, I would like to talk to him sometime, what he does.
Yeah, I can share
my,
his contact number. So,
okay, so I will also share what I do. There are so many methods of alternative medicine. We can't do all of them, but some of them, we can learn and implement it.
That's great, Shikharji.
Yeah.
Yeah, and the other thing about the water, so I heard several videos of Professor Rustam Roy. I don't know whether you heard his name.
No. No.
Yeah, he was in Penn State University. He was director of one center that they created in the university. And his remit was to look at all these alternative techniques and how do they work? I mean, do they really work, or this is like a tall claim? So you have, like in Brazil, there's a man who does psychic surgery with his hands. He does surgeries. So I mean, and so many things, right? The homeopathy, it seems to work, but there's no medicine in the liquid. There's nothing, no trace of it, right? So how does it work? And if it works. So he did a lot of these things, and he has several talks on YouTube. But again, I mean, he's passed away 10 years ago, but it's very, very amazing what he talks about. And he was saying water is the least understood element in the world.
Could be, yes.
Yeah, there's so much to water. I'm just thinking, water is heavier than air, but it knows how to fly. It flies from the ocean to our land, and then it rains down.
Yeah.
It sustains us.
Yes, of course, absolutely. And also,
Yeah, it's amazing.
our body is 70% water. So as you saw, the changes in the water molecules, and we do not know the energy what is changed from 7 kilos to 10 kilos and all of that. Is it because of the molecular changes it took place or something else? We don't. It is a lot of research work. Okay, but I'm just giving a basic information. There is a energy change which is undisputed. Okay, through the machine and also through the subjective perception. When I press the hand, it is like a steel rod. I can put all my weight. I have put in all my weight on some patients. I can't press it down. And more importantly, they're not putting an effort to hold it up either.
Right.
Before the water testing, when I had them to hold it, they had to put their effort. But when I put the water after their meditation, they're not putting any effort at all, but it is like a steel rod. Okay, you really have to experience it to really believe that. And I get so surprised. My whole weight I have put on patients, they are putting no effort, but still it is like a steel rod. Just half a teaspoonful of water in their mouth. That's all it is. So all of that, it is amazing, but there is a lot of
yeah, it is. And you probably know this is the dowsing process, right? This is one of the terms that is used as the dowsing.
Yeah.
For this technique. Yeah.
Okay.
Again, Dr. Murthy, what was the mantra that you were using just for people who joined in late? Can you, what is the mantra they use? They can energize their water every morning before drinking. They can do that. Everybody on this call and everybody who will listen to it subsequently can do that and attain some personal benefits from it.
Yeah. Salutation to Mother. I don't have any secrets here. Like some of the people, they say, we are going to give you Bija mantra, they're going to give you a personal mantra. I don't have any of those secrets. That is another topic I will discuss with all of you. Unfortunately, I have to join another Zoom in about 10 minutes time. So I would like to share that. Just briefly, I have done this testing with prayers, Roman Catholic prayers, Protestant prayers, Jewish prayers, Hindu prayers, Jain prayers, okay, then Rama prayer, everything I have done, and also on the mother prayers. The effect is exactly the same. Okay, we fight on the different gods and the goddess, my Ishtadevata and all of that. The impact on the body is absolutely the same. Lord Buddha, Lord Rama, Lord Shiva, Lord Mahavir, everything is the same. So I need to see how we can really approach, especially with the IHU. India was the spiritual leader of the world. Okay, so we can regain that spiritual leadership. Okay, in the way of educating them, in addition to competing economically, that is a different entity. But spiritually, we can still do that by spreading this practical concept of what we are finding here. We can discuss that another time. I'm sorry, we are short of time today. Okay, so we can discuss, and Scope Foundation, what I have done and other things, we can discuss it.
Beautiful. Very lovely thought to leave us with, Dr. Murthy, in terms of humanitarianism and in terms of broadening our message of our rishis and our culture to broader to the broader humanity. Thank you for all you do. Thank you for all that you have done today for us and for continuing the work with Scope Foundation. Thank you, everybody, for joining us today. I'm greatly appreciative of everything. I just want you to know this is my last discourse at IHU that I will be hosting myself. Shekhar Reddy can talk about what will happen in the future, but I have really enjoyed associating with IHU and each of you. My humble pranams and namaskaram to all of you. Namaste.
Yeah. Thank you for your dynamic. Thank you for your dynamic participation and also the contribution to the IHU.
Thank you, Shefalaji. Dr. Murthy, I just shared Dr. Ashwin Mehta's phone number to you.
Okay.
And yeah, IHU will continue the discourses, and we'll be receiving the emails and everything.
Yeah, we will do
Thank
that.
you. Namaste.
Thank you,
Thank you,
everybody.
Have a great day.
Thank you.
If you all
Thank
have
you.
any question, you can send it to me by email. No problem.
And this will be on YouTube, guys. Thank
Yes.
you.
Thank you.
All right. Thank you.